Well, let's go to Samsam. Let's bring you that report Fauzu Masawodo filed on their education, security, and above all, the health condition there. We will be having a conversation here on that. So you can get your messages coming 0204447033. Let's talk about the health sector of the country.
Located in the Ganwest municipality of the Greater Accra region, Samsam has for years been faced with several challenges due to inadequate basic amenities to respond to the growing population of the community. While poor road networks remain a widely acknowledged challenge, others, including the lack of proper healthcare infrastructure, continue to pose a significant threat to residents. We visited the only health facility in the area, where the nurse on duty, Portia Nagba, among other things, revealed that both male and female patients share the same ward due to insufficient rooms.
The ward is only one. Yes, we use for male and female.
The same ward for male and female.
Because that's the only room available. So we use it for male or female. As at when the detainee will come. Then we have maternity unit.
So before we go to the maternity, what happens if a male and female come at the same time? Does it mean that they sleep or they are kept in the same ward at the same time?
We have screens, so we just screen them.
So like a partition?
Yes, to separate them. That's what we do here.
But that's not the best, clearly.
Yeah, but service has to go on, so we manage.
You are managing the resources that you have. Okay, aside that.
So we have the maternity unit, then the RCH. Yeah, then we have consulting room, pharmacy, then the OPD. That's all.
So how many patients do you attend to, let's say, on an average daily?
Average, let's say 6.
6 patients a day?
Yes.
What are some of the cases that you usually, get?
We get malaria cases, UTIs, we have URTI, that's the cough. Then we have RTAs, sometimes home accidents.
Let's talk about the cough, for instance. Some residents we spoke to earlier say because of the dusty nature of the route and whatnot, as a health practitioner that attends to some of these issues, are you able to draw a connection between that and the cases that you get here?
Yes, during the rainy season, it's minimal. Okay. But dry season, because of the dust, you can connect it. There are most of them, because of the dust, they try to cough.
I'm told you don't have physician assistants here.
Yeah, we don't have. We used to.
But what happened?
She's been transferred.
There's not been any replacement ever since she was transferred.
Not yet.
So what do you do when you get more complicated cases?
Oh, we manage it. We give them first aid here. Okay. If we cannot, then we refer.
You refer them to Samsam Hospital. Okay, but tell me about your own experience as a nurse, as a health worker working in this facility. You've alluded to the fact that you are resource constrained and whatnot. But as a health worker here, tell me, the MP mentioned that he even has plans of expanding the place and even putting up a structure, possibly for some of those of you who work here. But in the absence of that, how has your experience been?
Nursing is a noble profession. So when you get inside, you have to love your job, do as you can to help Ghana. So wherever you find yourself, with the resources available, you try to give out your best. So we are managing.
But what will be your appeal to relevant authorities?
Okay, I'll appeal to the MP, then the authorities. If we can get a quarters around, it will help. Because the nature of the road is not helping. When you want to come here, it's very difficult. Going back you have to sit for hours before you get car, back to where you are staying. So when we get maybe quarters around, we can be able to stay so that if something happens in the evening or at night, we can be able to attend to the residents or the sick people around. So we think quarters will help. Then if they can improve the facility, it will help. We don't have laboratory services We have a pump there.
A pump,
It
okay.
was working, but of late it's not coming. I don't know whether it's because of the rainy. I don't know. I can't tell. So, if they can provide us with water, as at when it's needed, we will appreciate.
Do you have toilet facility?
Yes, we have. We have 2 toilet facilities. Yes.
Member of Parliament for Amasaman, Sedem Apenyo, noted plans to address these concerns.
The patronage here is very low.
Okay.
And the reason being that when you come here and you have to undergo some lab tests, you need to travel as far as to Amasaman, do the lab test, bring the results here before you are given medication. So the question is, why don't I go to Amasaman, have my lab test there, and then see whoever I have to see, either a doctor or a physician assistant there, and then take care of myself before coming home. So because of that, people feel that they wouldn't come here. Instead of coming here, they go to
Amasaman.
Exactly. Okay. So the patronage here is very low. But meanwhile, this has been built here to take care of the communities around. So Gono, Mimpenwansem, Samsam, and its surroundings. This was built to take care of their health. But unfortunately, because there's no lab, and currently there's no physician assistant too. So when you come here, people come knowing that there's no physician assistant. They prefer going to, as human as we are, you come and they tell you, doctor anyhow. So see the nurse. You feel that if the doctor is not here, then why am I here? So the patronage here is very low. I think if we can get a lab built here, or we can have one room where we have some few equipments for lab tests, it will improve upon the patronage. Yeah.
So this is like a CHIPS compound?
More or less.
More or less. But if we are talking about lab and having other, facilities to aid healthcare delivery, that means that there's also the need to expand the structure.
Exactly. You see, our population is growing. I keep saying this. In 2016, when we were going to vote, our population was about 78,000 voters. Currently, we are over 170,000. It's doubled. So the pressure on Amasaman Municipal Hospital is high. So the good thing we can do is to try and expand this little CHIPS compound and the community health centers we have. When we expand them and we add some few facilities, it takes off the pressure from Amasaman. So as you rightly said, this place needs a bit of expansion so that those living around this place wouldn't have to shuttle all the way to Amasaman to seek for medical care. Yeah.
Has it, undergone any form of innovation over time?
For this one, no. I've done a couple of them. I've done Kojo Ashon, I've done Don Sampama, but this one, no. But hopefully this year, we are even not just looking at the renovation, we are looking at expansion. The problem we are having here is that the land, when the land is sold and it's getting finished, the ones that have been given to government for facilities like this, they start encroaching. The last time I visited the director for health at the municipality, she was telling me that the problem they are having now is the land. And the old man who gave the land keeps telling them that if there's no documentation and he passes away, the other family members will start fighting for the parts of the land that has not been used. So we decided to try and demarcate and then see if we can do a bit of fencing. It's all got to do with money. If it's fenced, it will be difficult for someone to come and encroach. So we are looking at a little bit of expansion. Other communities are crying for health facilities like CHIPS compounds and all that. But for me, if we can put the existing ones in good shape, at least traveling to this place will be okay than going to build another one and then leaving this one to deteriorate.
Educational infrastructure also remains a challenge. Sedem Apenyo expresses deep concern about its impact on the increasing population of children in the community.
When it comes to education, let me say we have a big problem in Amasaman. With the population, you enter a classroom and there are about 120 children sitting in one class, 100 in a class with one teacher. So you can imagine. Some of them are sitting in threes on one desk. Some are sitting on, this time before your child is admitted, you need to come with a desk or you don't get admission because there are no sitting places for kids to come and sit. So you are admitted based on the fact that you are bringing your own desk or a table and a chair to get you a place to sit, to learn. So since I got in, I know I can't rely on government alone. The private sector is here. Amasaman, we have a lot of factories and companies around, like the Trillium, the Voltics, and so a couple of the roofing companies. Most of the school roofs are leaking. So they've been built for the past 20, 30, 40 years with no renovation. So when it rains, some of the roofs are rusted. The kids will have to close. Some also have their roofs ripped off when there's a rainstorm. So what I've done is to write to all the roofing companies to seek audience and then ask for support. So if you can help re-roof this, then we do it and then put your name on it, at least. It's like a corporate social responsibility. Yeah. So I've written to all of them. Very soon I'll be engaging them and then see how best they can come on board. We are constructing a bit of classroom desk, the dual ones, to help accommodate the kids. Because this day and age in Greater Accra, capital city, you are admitting a child and you're asking the child to
bring his own desk. It doesn't sit well.
Meanwhile, we're talking about free education. So I don't know how free the education is. If you talk about free education, it's not about you paying tuition fee. But even where you are sitting, if you have to pay for it, then how free is the education? So we want to take it from the basic level. The classroom desk, the windows, the roof. The few schools we have, we are trying to renovate. If you go around, you realize that most of the schools even have pavilions. Because the classrooms are not big enough to accommodate the kids. So Teacher Association are trying to build pavilions around to accommodate some of the kids. And because it's a pavilion, when it's raining and there's a bit of wind, they have to close because the water gets into the classroom. It's not, how do I say it? The sides are not protected. So the rain gets into the classroom. So for now, we are looking up to
the corporate bodies.
Exactly, within the constituency.
The
to help support, especially the roofing companies. We will do our part as government, and then we expect them to also support us.
So that is the Member of Parliament for Amasaman, Sedem Abenyo, having a conversation with Fauzu Masawudu, who went to his constituency, specifically Samsam, where he looked at the health situation there, that is with the health post that they have in the area, and also education. But Nana, like we are trying to have a conversation on the health situation.
Yes, and it's sad to watch the video and hear some revelations from the nurse that there's just one ward that serves both male and female, and if they have a situation where both sexes come to the hospital for medical attention at the same time, they are in the same space, but just what separates the ward, so to speak, is the partitioning or a curtain that's supposed to. How are we living in Ghana, Accra, with this kind of a health situation or a health post?
It's heartbreaking.
Nana, I need to commend our health service workers, because look, it will take a lot of dedication and passion to want to go and live in a community as such with little to no amenities. The fact that you are giving your all, but you don't even have what it takes to render the services for the oath you swore to do due diligence to your country and your community.
And at this place, they have only one ward for male.
Yes, that's exactly what I said.
So one ward for male and female.
Yes.
And then look at the size of the ward. How many patients
can they attend to at a time?
So if there's an outbreak in a community like this, what do they
I don't want to imagine what it would look like. Nana.
You see, it's serious, and I keep saying that we should not be playing with some of these things. You say our health is our wealth. We should not be toying with it. You get it?
Politicizing everything.
Exactly. How do you live in a country like this? And this is supposed to be a health facility that is providing health care to a community. Listen, I'm not too sure of the population of Samsam, but you cannot estimate anything below 500.
Of course. And if you don't get access to this health post or the CHIPS compound, or
what's the nearest health facility to
Amasaman Municipal Hospital.
How
so in the event of an emergency,
you have to go there.
And see the nature of the road you have to travel on.
Samsam is not having good roads, not having the education infrastructure they need. And I always say, but what I say, Nana will tell me that I shouldn't do that narrative that is in the Greater Accra region. This place is in the Greater Accra. No, it's not like it's far away from us. It's in the Greater Accra region.
No.
And it's
I do that.
Sawam Road. It's not like it's far away from us.
I do that on a lighter note. Not to say geographically, yes, it's in the Greater Accra region. But if I have to travel from my ghetto in Klagon to that place, That means I'm moving from to another region.
But it's still in Greater Accra region. You see, we think that in Greater Accra region, at least some sort of development should get up there. You understand? You wouldn't have a space where somebody, so to speak, is coming from, say, Zabzugu Tatale, and the person is coming to Accra. In my mind, I'm coming to the Greater Accra region. So
coming to meet a better development.
And maybe the situation here
is where I always argue with you.
It's even worse than what is in the north.
This is where I always argue with you.
Before we continue, let me just quickly let the viewers know that we want to hear from you, right? We want to connect with you. So call us and then talk to us about what the health situation in your community looks like. Do you have a good health center? Whether it's a clinic, a polyclinic, a CHIPS compound, or whatnot, let us know what the situation is. So you can call us on the number 0302-784-969, 0302-784-969. You can also send us a WhatsApp message on the WhatsApp number 020-444-7033, 020-444-7033. That's the number for WhatsApp. So do connect with us. Let's hear from you.
And they should also let us know what they make of the entire health sector in this country. Because see, people are going to the big health facilities and the private ones with insurance. So you have the insurance, you just go there, you swipe, and maybe the company you are working with is paying, or the insurance you are paying, the policy you are on is also
take care of it.
Taking care of everything. So you do not really feel it. I always say that the gap between the rich and the poor is very wide.
And it keeps growing wider.
Exactly. Because the rich is like, the rich is like, I can afford this, but the poor is like, without a national health insurance policy,
Philip,
I'm dying.
We have a call on the line. Hi, good morning.
Good morning, madam.
What's your name and where are you calling from?
Please, my name is Wachia Dombright, calling from Ofuanse, Santia South.
Ofuanse?
Yes, please.
All right, let's hear you. What's the health situation, or what's the situation of your health facility in Ofuanse?
Yeah, we have a big challenge in our health facility, especially the maternity care. They don't even have a bed. So when somebody's come to deliver, the midwife has to find a ways and means to get a place for the delivery person to deliver on it, which is very bad. And many times they have channeled their issue to the district director of health, but it seems like it doesn't yield any results. So I was enjoying your conversation this morning, and I tried to call so that if our views can be aired out, and that the district director of Asante Achem South Municipal also will come to our aid to support the health center of Ofuanse for maternity center. And secondly, to they lack staff. So I believe if the government can do something about that, it will help the facility to improve. Thank you.
Thank you very much for calling in. Interesting. Nana, it looks like we have a bigger problem.
We're going to open a Pandora's box with this thing. You'll be surprised to hear that even your so-called posh area, there's a facility there that is struggling.
That is struggling.
You get it? And you see, that's why I keep saying that you do not toy with the health of your people. What is your biggest resource in this country? It's your human resource.
Exactly.
And what does the human run on? It's health.
Yeah.
So if you toy with the health of your people, you are toying with your resources. You get it? And so we need to pay attention to some of these things. This thing we are doing, let's just listen to people and what their own experiences are. Let's speak to Kamaldeen. Kamaldeen, good morning.
Good morning.
I trust you're well.
Yeah, very, very well.
You're calling from Tamale.
Yes.
Great. What's your own experience?
Our experience should be counting on our disappointment on the leaders of Tamale Teaching Hospitals. You know, we have been counting these recent incidences about how the doctors are moving strike on everything. Look, the Tamale Teaching Hospital is having a very big problem which they have been facing for a quite period of time now. The competence of the doctors, the management, and everything. Despite the water crisis is now raising, mismanagement is the one which is causing it to get that escalating level. Yes. Looking at things, the water switches could have been replaced by buying water tankers and filling it with the tank if there was to be a good management on the facility. But looking, people are dying day in, day out. Out of like ignorance, I don't know whether positionality or something else that everyone wants to show power over everyone. Down to level, those who are listening will bear with us. The security people and the cleanliness, they are having more superior than the nurses themselves in their facility. We are not finding it so easy in Tamale here. Mismanagement is the number one key thing that they should be watching now.
Right.
Before they can think of maybe solving anything. Water crisis is very difficult in Tamale here.
Very well.
By looking at things, mismanagement, that is why I'm just crying off. Even if they can
Point well noted. Point well noted. Thank you so much. Let's have the opportunity for others to also call in. So, like you heard, so you see, there's a issue of inadequate infrastructure. There's an issue of inadequate human resource, the equipment issue, and sitting on top of all these issues and others is the management or mismanagement of the facilities.
And he was also mentioning the issue of water. And Tamale has been facing water problem for a very long time. So are you trying to tell me that a big hospital as the Tamale Teaching Hospital, we can't devise means or we can't come out with strategies or plans to give them water that we can use for our clinical services? Even if you are doing surgical procedure, you need water.
That's, you see, that's where the challenge comes from, the issue of the system failure.
We have a call on the line. Let's speak to the caller and then get back in studio for the conversation. Hi, good morning.
Good morning.
What's your name and where are you calling from?
Yeah, my name is Kay. I'm calling from Winneba.
Winneba, all right. Share with us. What's your story?
My happens to be at the Ridge Hospital where I brought in my boy who was 22 years. He was in the final year at Lagos. He had a brain tumor. And we spent more than 5 months at Ridge. And the experience over there was so tragic. First, we brought him to the emergency ward. And I quite remember when he was at the emergency ward, Honorable Nancy Boy's nephew also had an accident. And within the emergency ward, we could find.
Maybe you would have to call again.
Please call back.
I think what he's saying is very important.
Call back.
Trying to give some account of what happened at the Greater Accra Regional Hospital.
Right.
Health issues in this country.
So I think we have another caller on the line, Maxwell. Maxwell, good morning.
Good morning, sir.
And where are you calling us from?
I'm calling from Treba, close to
Obiman. Okay.
Yes.
What do you have to say about the health situation, in that area and generally nationwide?
Yes. I want to contribute about the health, concern the health. Even the MP you are talking with now is my MP.
Oh.
The area we are here now, it's difficult for us for even health center because of the land issue. So it's true that our MP is trying, but because of the land, we don't have the. That's why we have a problem of this kind of health issue. Even the area we are now, we need a school for from primary to get class 6, there's no land. So that is the problem we face in Greater Accra here. So thank you for.
Okay, Maxwell, thank you so much for your time, Nana. The problems enormous. You've had plenty problems. We just can't end.
I don't know.
Every day more problems. So with the health sector, maybe a total overhaul of the whole system. And that is why we will have our nurses and our doctors running away.
Yeah.
Because, like you stated, you won't go to somewhere that you won't have access to potable water. You won't have access to electricity to even charge your phone, connect back home, have access to maybe accommodation. And you want me to go and stay there, maybe unless I want to sacrifice. But I don't think a lot of people want to sacrifice like I want to do it.
That's why I'm saying that it will take a lot of dedication, sacrifice, and even the fact that, look, you need to tune your mind to say that I have chosen this path and I want to do it. Else, if somebody is just going into the profession just because of lack of jobs, because nursing looks beautiful, so I also want to be a nurse.
Oh, that beauty will clear.
Trust me, you won't get the people giving their all to serve the nation.
Yeah. I like I'm saying, we should be grateful to our healthcare practitioners, medical practitioners across the country, but at the same point, we should be holding duty bearers accountable and urging them to go out there and do what is required, because some of the facilities, the conditions there.
Nana, we have the gentleman we lost back on the line.
Good.
Good to have you back.
Yeah, okay, thank you.
Yes, so you were sharing with us your experience from Ridge, that's the Greater Accra Regional Hospital.
Yes. And this happened last year. Unfortunately, my boy passed on the 29th July last year.
So sorry about that. Our condolences to you.
Honorable Nilanti Vanderpoel brought in the nephew. And I complained bitterly to him. I even took him round because by then we have spent about a month at the emergency hall. So I took him round and look at this. Even the drawers that the patients were using, when you open it, you find cockroaches.
Wow.
You find cockroaches, everything. So I complained bitterly to the in charge, and it seems it has been going on for a very long time. So I once encountered the director general, the medical in charge, I think Dr. Raf Ama something, and I complained to him too. But the thing was going on. And the third thing that happened was, when there is an emergency, like my boy, the thing that they've been using to have the drip, the water wasn't flowing. I think his tissues were blocked, so they have to put a central line. And this central line, they told me that I have to buy it. I didn't know the third thing. I called Ad Farmer concerning the central line. They asked me of the measurement. I came back to inquire from the doctors. And one doctor pushed me aside and told me that, hey, if you don't know, go and buy this thing outside. They will tell you to go and bring in the person to come and fix it for your boy.
What? Wow.
Whilst you were even there, your colleague, the one on your left, he didn't came here for a lab test. I was at the lab when he came in with a lady, if he could remember. Somewhere last year. Yes, Philip, yes.
Okay.
Oh, okay.
Yeah, I was there.
Oh, so you saw me when I came there?
Yes, I saw you.
Oh, that's
I
nice.
also met Salom and the daughter at the emergency ward.
Oh, nice.
Salom also brought in the daughter. I mean, shook hands with him.
I came in there to do kidney and liver tests, so.
Yes, I remember. Yes.
And everything is...
So what happened was, they said if you don't know any, go and bring in the central line. You have to come and fix it. Bring in someone to come and fix it. So that means I have to buy it from the doctor. That was around 800 cedis.
Wow.
Whilst outside, you might get it at a cheaper cost. And when the time was due for the boy to have the surgery, they brought me the things that they will be needed for the surgery. So I had a friend at the Okais. I sent the items, and he gave me the amount. I also had a friend at the surgical unit at Kolebu. And when I came back with a list of the items that I said, oh, I've gotten them, so I have to go and buy it. The same doctor told me that, no, you can't buy it anywhere elsewhere. They will give you a place that... So I was happy when this Axis Pharmacy thing came up that Yoko was investigating them. They gave me the Axis Pharmacy number to call. That is where I will get the items. And I called, and then the guy gave me the amount, around 40,000 for the instrument for the tumor. Whilst at the surgical unit at Kolebu, I had it around 22,000.
18,000 difference.
Yes. And they also told me that you can't buy it there. When you bring it, they will not attend to your boy. What kind of country is this?
Wow.
Sad experience.
Yes.
And
one day, if you could invite me to your studio, me, I can bring you all the documents. I have them here.
very well.
And when I have put the payment at Access Pharmacy, I went and I told them that, madam, pay for the thing, give me the things and let me send them. Do you know what the guy told me? He said, no. When we give it to you, you might broach some parts and then you might spoil it, so you go. You come and give it to the doctor. I said, what kind of thing is this? And if you spend a week at risk, the kind of things you see concerning patients losing their relatives, even ambulance, common ambulance, somebody comes purchase the ambulance. Common ambulance. So I even have a discussion with the now Director General of Ghana Health Service. He should do something about this ambulance. We have these utility bills that we have a percentage going in for the fire service. Why don't they put in the ambulance so that people will not even bother to pay before they bring in their patients? The utility bill policies to cater for the ambulance.
Joe, thank you so much for your I don't know how to put it, whether he's ordeal, whether he's expression.
Yeah, but we sympathize with you, and condolences to you. We pray that the good Lord himself will comfort you on this particular matter. But while at it, we demand some level of professionalism, some level of accountability from the Greater Accra Regional Hospital, the Rage Hospital, and all other health facilities across the country. The minister has been there. I'm sure by now he's taking cognizance of whatever happens there, what the current situation of the facility is, and I'm sure some measures will be instituted to make it a better place. I mean, the hospital is not designed to be a place of pain. Okay, so you should be going there with your ailment and living there with better memories. Okay, you're not going there with your pain and leaving the hospital worse off. But sometimes the experience from the hospitals is just traumatizing.
We have Auntie Sisi from Nungwa on the line. Hello, Auntie Sisi. Hello. Auntie Sisi, good morning. You're marching. Yo, yet you.
We were midwife matron, we nursing officer. Now, on some aircon, I said, you can't be any finance for me. Yeah, Mushishi. May Bano energy wrong, or in salon, then with traffic, while 12.
We lost Auntie Sisi. We've lost
come back again.
Yes, Auntie Sisi, if you can connect with us, we appreciate it so that you
what she's saying, what I think I picked from what she said is she has a daughter who is a midwife, two daughters, but one is in the rural area, and she's been there for like 12 years trying to sacrifice a lot.
I see. These are some of the experiences we would like to hear. These are the ones that are sacrificing for you and I.
Of course, the profession is more of sacrifice.
It's sacrificial. It's service.
But you see, then again, I'll sacrifice. I would give off my best, but provide the tools. Let me sacrifice.
As simple as that.
Because if you don't provide the tools, I don't have syringes. How am I going to give somebody injection?
As simple
I
as
don't
that.
have something where as little as maybe bandage or cotton. How am I going to dress someone's sore? And I can't be buying it every now and then. For my meager salary, I don't know how much nurses are paid. Or doctors are paid.
Anyway.
Okay, we have Sawood from Winneba on the line. Sawood, please, good morning.
Good morning.
Your name again?
Saeed.
Saeed, okay.
Yes.
Share with us what you think of the health system, and if you have any health issue in your area, you can share with us as well.
No, okay. Actually, I'm a student at University of Education, Winneba.
Okay.
I was once involved in car accident. That was 2023, February 2023.
Okay.
From Tamale to Accra, at King Castle. So what happened is that I had this facial damage, and I was transferred immediately from King Castle Government Hospital to TTH, that is Tamale Teaching Hospital. Can you imagine when they sent me there at the emergency? I was allowed to lie on the ground for over 2 hours without a bed.
Why did they tell you there wasn't any bed available for any patient who is coming?
I could have seen with only one eye by that moment. because of how my face was damaged with my elder sister who was running up and down to get a bed for me. They discharged and they transferred some, patients from that emergency ward. The ward that the minister had problem with the doctors, that is the same ward I'm talking about, the emergency ward at TTH. I was allowed to lie on the ground for about 2 hours until one doctor, Edmond, came and saw me on that condition, and then he was furious on the next day before they gave me a bed.
Wow.
And even let me tell you, the line that they are talking about, whatever thing is happening in the TTH, Tamale Teaching Hospital, whatever thing you are going to pass through there, you must buy everything outside. Even a line, common line to put on me, blood, transfusion of blood and whatever. My family bought it outside. So these are issues about health deterioration in this country. The government needs to sit up. It is not only TTH, it's everywhere in this country. I advise our minister, our health minister, should sit up and reschedule, sit down with the directors of our health systems in this country so that we see the way forward of how to deal with cases, especially emergencies. So I was once a victim at Tamale Teaching Hospital. And I knew the things I passed through before that surgery, it wasn't easy. Everything, I bought everything in the hospital.
Wow.
Until I was discharged about 2 months before they discharged me from the hospital. So in the case in CTH, everybody knows what has happened. If you are from Tamale, we know the kind of maltreatment nurses and doctors put upon patients at Tamale Teaching Hospital. That is what I have for Ghanaians.
Said, thank you so much for calling us and sharing your thoughts on the health sector in this country and what is happening at Tamale Teaching Hospital. He has been a victim. He has been there. He has witnessed what the issues are, and if it has to be done, it has to be done fast. I don't know how best we've resolved the issue with no bed syndrome.
We've come a long way,
yes,
but I don't think it's ended yet.
No.
There's more that needs to be done. Once there's population growth, health issues will increase. But if the infrastructure is not growing to meet the growth of population, then definitely we are going to have a deficit. And once there's a deficit, it's going to create more problems for us within the sector.
Nana, we have a caller from Ablekuma. Hello, good morning.
Good morning.
What's your name?
I'm Kwesi, calling from Ablekuma.
Say that again. I didn't get your name.
I'm Kwesi, calling from
Kwesi. All right, Kwesi, let's hear you.
Yes. I'm Kwesi, calling from Ablekuma.
Please go ahead.
Kwesi, let's hear you. And kindly reduce the volume of your TV and listen through the phone.
Okay. So I would like to contribute to your program. I think another listener sent in a message indicating the use of IGS, that is internal you see,
hello? Kindly turn down the volume of your TV set.
We need to have a national discussion on these issues. The equipment are too expensive. Yes, the facilities are generating ideas, but it's nowhere near the expenditure they are making. You have to pay for electricity. You have to find other sources of water. Currently, I work in a hospital in Greater Accra, and I can tell you the water.
Hello?
I think we've lost him.
Oh, we seem to have lost him as well.
But he wants to talk about the water situation about a hospital
in Greater Accra region.
In Greater Accra.
It remains a challenge. I mean, a hospital cannot run without water. It's just basic like that. If there is erratic power supply, that's an increased cost burden on the facility. If water supply is not constant and consistent, that's an increased cost to the facility. And so while management is dealing with the essential or its core mandate of providing healthcare, it now has to deal with the administrative issue of looking for water and electricity, which of course is going to come at an extra cost. You get it? So we are not saying that, or we are not giving the humans in these facilities a bad name just to hang them. We understand and appreciate the challenges that they go through, okay? But then again, we are asking that based on the oath that they have taken to be caregivers, to see to our medical care, they should go all out and do same. While at it, duty bearers, people put in places of authority, given the mandates to exercise certain duties. We cannot entertain any lackluster attitude, of course, regarding our health. You get it? I won't toy with my health. I won't sit and see something that is going to cause me a disease and then ingest same. You get it? And if I'm seeking medical care that I am paying with my hard-earned money, I would want the best of treatments.
If the duty bearers are stopped
from traveling out to seek medical, that thing is worrying you, eh?
Yes. See, because we don't, people can't, see, you can't easily
you can't stop anybody. You can't stop anybody. So if I can afford it, you are not. So what will you do? I'm going to pass a law to stop me.
I don't know, but
I can afford it. What will you do?
We should prioritize that.
Prioritize what? We should prioritize improving our infrastructure. Yes. That should be where the priority is, not somebody traveling abroad.
Problem with the infrastructure if I don't go there.
Yeah, go to see the problem.
But that's what I'm saying, that somebody sits atop of all of this. The back stops with leadership. Somebody sits atop of it. Somebody is briefed consistently on the states and of conditions of our health facilities. That person should act. Basic.
Let's see how that one goes.
So there's a message here speaking about Phillips with the
government
officials flying outside the country to receive medical care. This one says, good morning to the entire panel. This attitude of government appointees is becoming unbecoming. The arrogance is too much. However, the same minister will fly outside for medication. Thus, they don't care whether or not our doctors go on strike. Another one also says, the presidential hospital in Boku is the only hospital that everybody in the municipality can access for good health care. But because of the situation currently, we are lacking a lot of medical doctors and medicines for patients. We are pleading to the government to help us with doctors to save lives of the innocent ones. Thank you for your good work.
There's a message coming in. Look at the whole issue. Look, the whole issue of our health system is about tools or equipment. You can't save lives without tools. The whole health system is running out without the requisite tool or provisions. No beds, no IV fluids, medications, broken down ambulances, and other essential vehicles, etc. This is coming from Boku Hassan. And
there's another one also from Konongo by Kwabna. He says, hello, good morning. As we discussed all the deteriorating conditions at such facilities, we forget how the government needs to take care of those devoted patriots working there. True. The last time these noble teachers and nurses received their salary was the 21st of last month. They have gone 36 days without any good salary paid to them. Government should be serious with this lovely devotees.
True. For me, it's simple. There's a language that these politicians understand.
Strike or demonstration.
They like the aggression. You see that this time, like teaching hospital thing happened. No, a day after, 24 hours, we are doing donations to them. Where did the equipment come from?
Well, like I was saying, maybe the minister ordered for them. And
where did he order? He went to Tamale the day before. In 24 hours, he's making a donation.
On his way back from Tamale, he ordered.
They know where all the equipment is sitting. They know where all the challenges in these hospitals are. But for political gain, they do what they do. Stop subjecting people's lives to your political
Before you go on the break, there's a message. I'm Kennedy. My father is here in Ho Teaching Hospital. I've asked about the security or the security man for blood, and he told me to pay 1,400 Ghana cedis for blood.
But why is he asking the security man for blood?
I have to ask the security man for blood. And he told me to pay 1,400 Ghana cedis for the blood, and truly the blood was given to my father. So the security man even knows where the blood is.
But
the security man is a vampire.
The security man for blood anyway.
Anyways, this is Breakfast Daily. Stay with us. We have a lot more in store for you right here on the show.